Welcome to the Corn Zoomer walkthrough video. My name is Brooke Mader, and I am a clinical educator with the Vibrant Clinical team. The Corn Zoomer is one of the many food zoomers that Vibrant offers. Food zoomers are a peptide-level antibody food sensitivity test. The Corn Zoomer can distinguish a sensitivity to organic versus GMO corn. Corn is one of the most commonly consumed alternative grains on a gluten-free diet. It is extensively used in processed foods as a filler, sweetener, binder, and as an anti-caking agent. You may want to consider running a corn zoomer if a person has a positive wheat zoomer and symptoms continue even after following a 100% gluten-free diet. Persistent symptoms in wheat-sensitive individuals on a gluten-free diet could be due to their consumption of corn-based foods. These are the markers that are measured on the corn zoomer. These are proteins specific to corn and GMO corn. And this is what a corn zoomer panel may look like as far as what is being reacted to. Corn Zien is the major protein in corn that induces a gluten-like cellular immune response in some celiac disease patients. So this is not a cross-reactivity. Instead, this protein has a similar type immune response that gliadin does. So if you have a gluten-free patient who is still experiencing some degree of GI inflammation, you may want to run a corn zoomer simply because corn is one of the most abundant grains and a common gluten-free alternative. Antibodies to Zien may remain high until both corn and wheat are withdrawn from the diet. There's also corn-wheat overlap epitope. It's a protein in corn that is similar to a protein in wheat, and individuals who are wheat sensitive typically also make antibodies to this protein. So anyone making antibodies to this should also be wheat-free. But anyone showing reactivity to both corn Zien and corn wheat overlap epitope, a grain-free diet may be appropriate. Of course, unless the individual has no problem eating other gluten-free grains like rice or buckwheat. The corn zoomer and the soy zoomer both test for GMO proteins. The corn cry proteins are proteins used in the manufacturing of genetically modified organisms. Essentially, this is a toxin derived from bacteria that's been genetically modified into varieties of corn in the United States. It acts as a defense mechanism for the plant, so the plant is resistant to pests. Cry proteins have been used as pesticides by either spraying on the crops or adding it to the DNA of genetically modified corn. Cry proteins kill insects only when ingested. They form pores in the GI tract of the insect, which leads to swelling and ultimately death. Cry proteins were claimed to be digestible in humans, but a group of scientists in Canada have identified that these cry proteins can make their way into human blood and may be damaging to our health. These proteins have been found in pregnant women's umbilical cords. They can be damaging to lungs and other organs. It can cause eye irritation and swelling, and in the most serious cases, maybe even blindness. Individuals making antibodies to corn cry protein should eliminate all GMO corn. There's also cross-reactivity with corn Thioredoxin, wheat Thioredoxin, and grass pollen Thioredoxin. These proteins are similar in structure and closely related to baker's asthma. It may indicate the need to eliminate wheat in order to reduce the asthma-like symptoms. If the person doesn't have asthma-like symptoms, this may not be a concern. Corn lipid transfer proteins have a high cross-reactivity with peaches and rice. So this is a case where going corn-free may not be enough. Peaches and rice may also stimulate similar symptoms in individuals who have antibodies to this protein. Corn endochinase has a high rate of homology with grapes, which means if someone has antibodies to this protein, they may also experience symptoms when consuming grapes as well, due to the similar protein structure. Symptoms of corn sensitivity can often mimic or overlap with symptoms of other conditions or other food sensitivities. Distinguishing between corn sensitivity and other conditions can be difficult without specific peptide level testing. Sensitivities to peptides in corn can show up hours or days after consuming a product with corn. It is recommended to eliminate corn for 3 to 6 months if someone is reacting to it. However, if Zien, Cry proteins, corn wheat overlap epitopes, corn Thioredoxin, corn lipid transfer protein, and corn endochinase are positive, then reintroduction should only happen after confirming that the intestinal barrier is healed. Refer to the Corn Zoomer full report for guides created to help implement a corn-free diet, including common hidden sources of corn. Corn is just as ubiquitous as wheat in the American diet. There are obvious sources of corn like corn flour, high fructose corn syrup, popcorn, corn chips, and corn flakes. But there are a lot of possible hidden sources of corn like ketchup, instant coffee, candy, fried foods, baking powder, and Cheerios. So download the guides as they can be very helpful in directing you or your patients where to look and what foods to avoid. The education tab in the portal will also have a lot of information for you to download.